Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our March episode, we marked National Kidney Month with Dr. Kristin Meliambro. In our March keynote, Dr. Meliambro explains how dialysis works and shares new treatment options that help make daily life more manageable for patients living with stage 5 kidney disease. Can you explain dialysis? I think many of us have heard the word and sort of know what it is, but could you explain what exactly happens?
Yeah, so dialysis is a process by which the blood is cleaned when the kidneys are no longer able to. So it's sort of doing the work of the kidneys, but it's not acting as if you have completely normal kidney function. So basically, your blood is circulated through a dialysis machine, and there's something called dialysate bath or dialysate fluid that runs in the opposite direction through a filter to which your blood is running, and things are exchanged. So in this way, things like certain electrolytes, certain toxins, even ones that we don't measure, fluid can leave the blood, and then in return, clean blood is returned to you. So it's a circuit. A common misconception is that dialysis is going to improve kidney function, that it's like a treatment. It is a treatment, but it's doing, it's sort of getting you through, but it's not making your own kidney disease better.
Right. It's not a cure.
It's not a cure. In best case scenario, it would be a bridge therapy. So ideally, if you could be a candidate for a kidney transplant, dialysis would be temporary, and then you would move on to a transplant. Some people, transplant is not an option. We try to get everybody, who we think is a candidate, and even some that we're not sure. We try to be very aggressive in transplant referrals, but for some people, due to other comorbidities or other factors, it's not possible. Now, there are a few different types of dialysis. So the standard, what's most common in this country, is hemodialysis, which is what I described when your blood is passing through a circuit in a machine that's next to you, oftentimes in an outpatient dialysis unit or dialysis clinic. The standard sort of prescription is you go 3 days a week. So it's like Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. And a standard treatment is 3.5 hours. Some people it could be a little shorter, but it's usually at least needed 3.5 hours. Some people even a little longer.
Right.
So that's hemodialysis. Now, hemodialysis can be done at home. So there's sort of like a smaller version of that machine that for some patients may be appropriate. Now, patients and a caregiver or family member have to be trained to be able to do it at home, because it's not that a nurse could come to your house to do it whenever you need it.
Right.
Oftentimes, people do it more than 3 times a week when they do home hemodialysis. Maybe, same amount of time, maybe a little shorter, maybe a little longer. And there's great outcomes with home hemodialysis in terms of avoiding hospitalizations, for example. There's another type of dialysis that can be done at home. It's called peritoneal dialysis. That is different from hemodialysis, which is, again, your blood leaving, circulating through a machine and returning back to you. It's actually done through the abdomen, and it uses the blood vessels, small blood vessels in the peritoneal membrane, which separates, it's a membrane that encompasses the abdominal organs. And you have a catheter that comes out of the abdominal wall. It's external, but it'll be, wrapped and dressed so that, to minimize the risk of infection. And basically, fluid that has a carbohydrate concentration is sort of dwells into the abdomen. It stays in there for a couple of hours, depending on the prescription. And then through those small blood vessels in the abdominal, the peritoneal membrane, there's the exchange process that would occur in the hemodialysis, in the bigger filters in the dialysis machine. That is a form of home dialysis. It can be done with an automated machine called a cycler. And oftentimes, once people are trained and sort of get into the therapy, people can do it when they're sleeping at night at home. So it allows you to not have to go to an external unit and carry on a lot of normal functions that you previously did. It's also shown to have, again, lower association with hospitalizations, and some of the other issues that we see, with patients who are on hemodialysis chronically. So it's a great option for people who may be candidates. And, there's a lot of home dialysis programs nationwide.
Yeah, I was going to ask what makes you a good candidate for that.
You have to be engaged, in your healthcare. You have to be able to see well, so not have any visual deficits. And, you have to have a certain level of, I would say, both awareness and sort of understanding to be able to follow the instructions to hook yourself up to the dialysis machine, for example, whether it's home hemodialysis or peritoneal dialysis. Sometimes if you have a caregiver or, family member, friend who can do all these things and is always with you, that could be a way to get around it. The other important thing, and this you're actually evaluated for, is do you have a safe and clean home environment, which is not the case, unfortunately for everybody. And you have to have a space to have your machine, to have your supplies, the bags of fluid and things like that. So actually the home dialysis team does a home visit and make sure. I've had some, barriers with people, for example, who have pets where there's a concern they may jump on things. They may, chew on the lines and things like that. So then it becomes a very personal decision. Is this something you can eliminate or somehow keep out of that environment? But it's a really great option. So I introduce that option when I tell patients, we're getting to that point and it's something that we have to plan early for. Same thing with referral for transplant evaluation. I always mention home dialysis as sort of number one. And then if people, we have, like, for example, at Mount Sinai, we have a home dialysis team, a nurse who will reach out to the patient. They can come in for an education session and sort of figure out if that might be the right option for them. Some people tell me right off the bat, I can't do it. I don't want to do it. It's too much. I'll just go to the clinic. And that's, whatever works for you.
Yeah.
But because there are such good outcomes with home dialysis, we do really try to introduce that up front and make it as accessible as possible.
That's great. And I don't think a lot of people know about that option.
Yeah, I don't think so.
It's nice to have choices.
Yeah, absolutely.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.